Today we want to talk about acne vocalis. Do you know that if you don't understand that some acne are classified as mild, moderate, severe, you might be doing things that will be making your acne worse and you're wondering why the acne is not going. So I'm going to take you through how to identify mild, moderate, and severe acne and what you need to do if you have any of them. So acne vocalis is the commonest type of acne that people have. About 80% of the world population have had acne vocalis at one point in their time, which usually start at puberty age. So for mild acne, they are characterized by the presence of non-inflammatory pimple. Pimple is divided into two, inflammatory and non-inflammatory. And the non-inflammatory pimple could be it could be blackhead or whitehead. And then the blackhead is when it's looking black, like the pores are clogged, it's looking black. The white hair is like the color of the skin or even yellowish in color, but not black. That's how you differentiate. It can be seen on the face, it's scattered all over the face, at the back, on the shoulder, on the chest. So pimples that are not so obvious, they are scattered all over and is black or white and not red. When it's red, that's when it's inflamed. It's regarded as mild acne vulgaris type of pimple. Sometimes you can also have some small red, like maybe 2, 3, 4, 5 number of red lesions on the face, together with the black or white hair or mixture of the three of them. This is because sometimes the condone, which we call the black or white or non-inflammatory pimple, can develop into inflammation. But so far the inflamed pimple is still small, the pimple is still regarded as mild. Moderate kind of acne vulgaris have more inflammatory pimple on it. It can be in form of pustules or papules. Pustules are the ones that have pores. You see something that looks like catarrh, creamy substance in it. Those are the ones, or when you press it, although it's wrong, when you go to dermatologist or skincare spa and they pop it, they bring out whitish substances in it. Those ones are the ones they call papules. Pustules does not have any pores in it, it's just red and inflamed. And then sometimes you can have multiple papules in the same location. So those are when you see a lot of inflamed pimple, that is when it is regarded as moderate kind of pimple or acne. The moderate kind of acne can still also have blackhead and whitehead, just that the inflamed pimple will be more than the blackhead and the whitehead. The severe form of pimple is the one that has cystic nodules in it. It has pimples that on the surface you're not even seeing, but when you touch it, you're feeling the pimple. You feel the pimple. And then nodules, like very large, big pimple with pores. And then it covers a large number of surface area. That's when you know that the person has severe form of pimple. It's when it's not healing. The pimple is not going, it's not healing, it's not drying up. It's there, it's soothing. And it's taking a while to heal. And when it eventually heals, it leaves scars. So those are the type of severe pimple. And severe pimple can cause pain. When you touch it, it causes pain. It takes a long time to resolve, and it leads to scarring. And it can affect people's self-image. That is why if someone has severe pimple, the person needs to have patience, because it will go once it is treated. It will go, but you need to be patient. It might take 3 to 4 months to go, but it will go when you go to a dermatologist. In case they didn't explain that to you, the dermatologist is supposed to explain to you that it will take a while to go. But because of our quick nature, we want things fast. They might not tell you, but I'm telling you now that it will go, but it may take a long time for it to go. Now, depending on how severe the pimple is, different acne vulgaris treatment regimen can be recommended. There are so many regimens that can be recommended, but what we'll be treating here is mild acne. For moderate and severe acne, you need to go and see a dermatologist. You need to visit a dermatologist, but you need to maintain a skincare routine. You can start the skincare routine before going to see a dermatologist in case you need to make plans for that. But even before, after, and during the time that you're seeing the dermatologist, you need to develop a skincare routine. That was what caused my own painful acne history, because when I saw the dermatologist, she didn't tell me that I need to start doing some skincare regimen. After the treatment, I thought that was all. And then 3 months later, the pimples started coming back until I understood that the condition that caused that pimple has not left. It's still there. It's in my gene. I have oily skin, and the oily skin have not changed. So I needed to start doing daily skincare routine to maintain healthy skin after the pimple, the acne has been treated. So if you have moderate or severe pimple, you need to see a dermatologist and This is a mistake. It's supposed to be moderate or severe. You need to see a dermatologist, and once you've seen the dermatologist, you need to start a skincare routine, which I'll be dropping in the next video. So for mild pimple, you can start using topical retinoid. Topical retinoid, like things that contain retinol, things that contains tazarotene, things that contains adapalene, to lessen the inflammation and clear the pores. And then topical products like benzoyl peroxide, which is both anti-inflammatory and also removes dead cell. Then you can use topical antibiotic like clindamycin. I purposely left this erythromycin, but I want to say this: do not use any topical product that contain erythromycin, because erythromycin scientifically have been shown to cause resistance. So don't use any product that contain erythromycin. Stay away from any product that contains erythromycin. You can use clindamycin. You can even use doxycycline if you see any that contains it. But stay away from any product that have erythromycin, because once the microorganism becomes resistant to the antibiotic, it will take a long while for the acne to clear. So please stay away from product that has erythromycin. Salicylic acid will help you to exfoliate your skin so that it can open up the clogged pores, and also it's also an anti-inflammatory agent. So in my next video, I'll be giving step by step method on how to clear mild acne, and then I'll be giving skincare routine that you need to maintain for both mild, moderate, and severe acne. So stay tuned and subscribe to my channel if you enjoyed this video. Have a wonderful day and bye.